This is an unusual case in that Kim has presented to a CAMS team for what on the surface seemed like some mental health issues and vulnerabilities that are common for young people. But then with a bit of exploration, there's a whole framework of trauma occurring in this family, and that can take a new clinician or an inexperienced clinician by surprise, the level of depth and complexity. But it does demonstrate to us that each individual that we work with comes from a system and a systemic approach, a family-based approach, looking at a collaborative approach, can really uncover lots of what lies beneath the initial presentation. So there's a very clear role for collaboration as part of a healing process in working with people that have come from incredibly traumatic lives or had traumatic experiences. Collaboration as a system in working with them really is part of the process of healing and moving from a place of trauma to a place of strength and a place of resilience. So the major role of a therapist is to build a therapeutic alliance, to develop a system of trust with the people that we're working with, and to discover the complexities of a system which at times can be quite complicated. If we look at the presentation of Kim, the complexity of his family history and his social system is multi-layered, and as we explore it, we see all the different layers of trauma. And we need to work with all these different layers of trauma to look at the levels of resilience within those layers, and also at the strength and how this affects the big systemic view. The way in which we work with families is we can look at it as a metaphor for what's happening in the family system. You look at the metaphor of the way that a system is working with that family. If it's working in a methodical, organised process, or if it's working in a chaotic and haphazard process. Often we reflect the life and the journeys of the clients that we're working with. And when we're talking about people that are presenting with depth of trauma, that again can be quite confronting therapeutically and clinically, and it requires us to reflect on how we process that information and what we do with the information that we attain, how we work with families, but also what we do for ourselves for that level of trauma. It can be quite a confronting process in therapy to try and break down some of what people's needs are and to try and identify trauma from a place of resilience and also from a place of strength to see where people's capacity is within that trauma framework. So we also need to consider the impact that our clients' lives and their stories have on us, on our well-being, particularly for people early in their career, inexperienced clinicians, or perhaps people new to hearing about and working with the level of complexity that trauma can create. So we need to think about good training as a mechanism of dealing with what we hear from our clients, and we also need to reflect on the benefits of using clinical supervision and how that can really assist a clinician to process through some of the effect that listening to people's trauma stories may have on you as a person, because clearly integrated beings, it's very difficult to separate that human experience from your clinical role, and good supervision is the mechanism to explore that in order for us to actually be useful for our clients, in order for us to not get caught in the trauma and actually then traumatise ourselves in that process.